Good day everyone. In this video, we are going to talk about peptic ulcer. What is peptic ulcer? Peptic ulcer disease, or PUD, is a break in the inner lining of the stomach, the first part of the small intestine, or sometimes the lower esophagus. Peptic ulcer disease is a condition in which painful sores or ulcers develop in the lining of the stomach or the first part of the small intestine. Normally, a thick layer of mucus protects the stomach lining from the effect of its digestive juices. Now, which parts of the digestive system are involved or affected? Peptic ulcer commonly occurs in the stomach, duodenum, and lower part of the esophagus. If the ulcer is in your stomach, it is called a gastric ulcer. Gastric ulcers are most frequently seen on the lesser curve of the stomach at the junction of the body and antrum. If the ulcer is in your duodenum, it is called a duodenal ulcer. Duodenal ulcer occurs most often in the first part of the duodenum or in the pre-pyloric region of the stomach or antrum. For the signs and symptoms, patients develop epigastric pain, or also known as stomach pain, that is long-standing and sharply localized. The stomach acid makes the pain worse, as well as having empty stomach. The patient also acquires discomfort of a duodenal ulcer, which is mostly common on an empty stomach in 90 minutes to 3 hours after eating, which causes the patient to have discomfort in the middle of the night. There are also additional symptoms such as vomiting or vomiting blood, which may appear red or black, dark blood in stools, or stools that are black or tarry, trouble breathing, feeling faint or lightheaded, nausea or vomiting, unexplained weight loss, and appetite changes. So what are the causes or the factors that may cause peptic ulcer? There are two main causes of peptic ulcer disease. First is the Helicobacter pylori bacteria, or also known as H. pylori. It sticks to the layer of mucus in the digestive tract and causes inflammation, which can break down the protective lining inside the stomach. These germs can enter your body and live in your digestive tract. After many years, they cause sores, called ulcers, in the lining of your stomach or the upper part of your small intestine. For some people, an infection can lead to stomach cancer. There are also other possible causes of having peptic ulcer disease. In rare cases, peptic ulcer disease can be developed when you're having a surgery and taking medications such as steroids and being seriously ill from various infections or diseases. Suffering from Zollinger-Ellison syndrome, or better known as gastrinoma, may also cause peptic ulcer disease. This condition forms a tumor of acid-producing cells in the digestive tracts. The acid cells being produced by this condition, which are in excessive amounts, would damage the stomach tissue if not treated. For the medications, treatment for peptic ulcers depends on the cause. Usually, treatment will involve killing the H. pylori bacterium if present, eliminating or reducing use of NSAIDs, if possible, and helping your ulcer to heal with medication. Medications can include antibiotic medications to kill H. pylori. For example, amoxicillin, clarithromycin, metronidazole, tinidazole, tetracycline, and levofloxacin. Next, medications that block acid production and promote healing. For example, proton pump inhibitors, also called PPIs, which include omeprazole, lansoprazole, rabeprazole, esomeprazole, and pantoprazole. Medications to reduce acid production are also being used in order to treat peptic ulcer disease. For example, acid blockers, also called histamine or H2 blockers, which reduce the amount of stomach acid released into your digestive tract, which relieves ulcer pain and encourages healing. This includes famotidine, cimetidine, and nizatidine. Antacids that neutralize stomach acid are also being used in order to treat peptic ulcer disease. Antacids neutralize existing stomach acid and can provide rapid pain relief. Side effects can include constipation or diarrhea, depending on the main ingredients. Antacids can provide symptom relief, but generally aren't used to heal your ulcer. So that's it for our discussion regarding peptic ulcer disease. We hope we were able to include and cover all of the necessary information in order to help you understand this topic better.